Dear students, it is 11th class. Today's my topic is internal structure of heart. The internal structure of heart is number one auricles. The auricles act as collecting chambers for the blood returning to the heart. They have thin walls as they have to force the blood into ventricles. The two auricles are separated from each other by a partition called interventricular or intra-arterial septum. Then the ventricles. These act as distributing chambers. They have thick walls. Then auricles. The wall's left ventricle is about 3 times thicker as that of the right ventricle because the left ventricle has to pump the blood to farthest end of the body, whereas the right ventricle has to send the blood to the lungs, which is nearby. The two ventricles are separated from each other by a thick curved partition called intraventricular septum. Then the great blood vessels, apertures and valves. The blood vessels that enter or leave the heart are called great blood vessels, which are the vena cava. The right auricular receives two large veins, superior vena cava and inferior vena cava. The superior vena cava brings deoxygenated blood from head and upper region of the body. The inferior vena cava returns the deoxygenated blood from the lower region of the body. The right auricle also receives a small coronary sinus. It returns deoxygenated blood from the heart wall. Right auriculoventricular aperture or tricuspid valve. The right auricular opens into right ventricle through a wide passage called auriculoventricular aperture, which is guarded by a valve called tricuspid valve. Pulmonary arch and semilunar valves. The right ventricle from its upper left corner gives off a large blood vessel called pulmonary arch or pulmonary aorta. It divides into left and right arteries that carry deoxygenated blood from lungs for oxygenation. At the base of the pulmonary arch are three membranous pocket-shaped flaps, the semilunar or SL valves, which prevent the direct return of blood to the ventricles. Then the pulmonary veins. The left auricle receives four pulmonary veins, two from each side. They bring deoxygenated blood from the lungs. They have no valves. Then the left auriculoventricular partition or bicuspid valve. The left auricular opens into left ventricle by a large passage called left auriculoventricular aperture, which is guarded by a valve called bicuspid valve. Then it is systematic aorta and semilunar valves. The left auricle gives off a large blood vessel called systematic aorta at its upper right angle, which has three regions: ascending aorta, arch of aorta, and descending aorta. At the base of the ascending aorta are three membranous pocket-shaped semilunar valves to chuck the return blood into ventricle. Just beyond the semilunar valve, the ascending aorta gives off right and left coronary arteries that supply blood to heart wall. The arch of aorta gives off three large arteries, brachiocephalic, left common carotid, and left subclavian arteries. The descending arch supplies oxygenated blood to the various parts except lungs.